DNA, we can have the pictures.
Carry those pictures because people will see it.
Yeah.
Those are good pictures.
Yeah.
So, obviously, the main topic today is your expansion plan. So,
Sure.
could you just give an introduction about what the expansion plan is?
Yeah, I mean, the expansion plan actually starts off from where we are today and where we have come from in the past. The past is pretty much well known to all the people of Bahrain because we've been, being the first hospital in Bahrain, we've been as an organization in existence for 120 years. And we've been providing healthcare, uninterrupted healthcare, as a not-for-profit hospital to the people of Bahrain for 120 years. And over the last 5 to 7 years, we have substantially, enlarged our footprint in Bahrain. Initially, the only place where we had was the American Mission Hospital in Manama. In 2000, we started a small clinic in SAR. But over the last 5 years, we've expanded. We've got a much bigger facility in SAR, which is our own. We bought the land, we own that. And then we opened up an ambulatory care facility in Amwaj, and we've got our largest ambulatory care facility in Rifa, which has complete facilities for sports medicine, hydrotherapy, and all of that. So that's in Rifa. And plus we've got Manama. So currently we are on 4 sites. But in order for us to expand our clinical services, we certainly could not expand our clinical services in Manama because of the lack of space, old facilities, and Manama being increasingly crowded, people find it difficult to come into Manama. So our expansion plan pretty much started from the time that I first came here about 10 years ago. But it was the question of finding the right location and of course getting a large enough piece of land for us to do that. And we first approached the Royal Court, and His Majesty was good enough to provide us with a large piece of land in Ali. And the location is opposite the Ramli Mall, that location near the Philippine International School and Open University. We've got a large piece of land there. And so once we got a piece of land, the next thing was now to develop the concept design to build a new hospital. And for us, it was not about simply building another hospital. It was about looking at what the healthcare needs for the people of Bahrain is going to be like in the next 25-50 years. So our plan was not to build a hospital based on plans that existed 10 years ago, 20 years ago. A lot of people build large hospitals, 500, 600 bedded hospitals in various parts of the GCC. But the future of healthcare really is that much of the care in the future is going to be delivered at home or in the community. Very few people will actually come and lie in the hospital, excepting for having babies or people undergoing surgery or major surgery. Even surgery, 60% of the surgeries now are day surgery. You come in, get your procedure done, and you go home. So you really don't need inpatient facilities. So the concept of healthcare is shifting on 2 grounds. One, it is shifting from the traditional sickness model of healthcare, meaning that you're sick, you come to the hospital. But that model is being shifted to wellness care. We want to keep you healthy. The role of a healthcare provider is to screen people, keep people healthy out at home and in the community as productive, healthy citizens, to prevent illness. So it is true healthcare. Now what we are practicing is sickness care. But that is shifting down. And when you shift from sickness care to healthcare, it means that you have to have a much better communication with your patients. Not just in the 20-minute consultation that happens in the hospital, but through the continuum of their work and lifestyle out in the community. So that is going to happen big time because of technology now. And technology is disrupting the traditional models of healthcare, from a patient having to always come to a hospital to visit to a doctor. So basically, in the next maybe few years, follow-up care for a patient coming back to a hospital is going to be obsolete. It is all going to be done through medical apps, where you will schedule an appointment to see your doctor through an app, and you will have the consultation. It's a 5-minute consultation. No travel, no parking, no nothing. But maybe the initial consultation will be here, but the follow-up consultation are all through medical apps. So that's one small example of how that's going to completely change care. So the hospital that we are building is going to be what we call a completely integrated healthcare model that will facilitate that type of a healthcare. Not the traditional clinic where you come and see the doctor, go back and come back and see the doctor. But the hospital will function as a central satellite hub from which wellness care, health care and sickness care is all provided. And if necessary, the patient will actually come to the hospital, and if the patient needs surgery or needs delivery, the patient will stay in. And so the technology will allow us to stay in touch with the patient, not just for the 20 minutes when the patient is in the hospital, but right through the continuum of the patient being out of the community. For example, if you're a diabetic, and if you have a Fitbit device that actually where you can record your blood sugar or urine sugar maybe once or twice a day, that data is immediately fed back to us. And we can see whether how your blood sugar control is even without you visiting us. So there are several ways in which this kind of healthcare is going to be promoted. Another example, we are creating what is it called the American Mission Hospital e-healthcare platform. And on this e-healthcare platform, one such thing is this, as I mentioned, through apps. The second thing is that telemedicine. Telemedicine means you can consult a physician anywhere in the world. You come to our facility, we can connect you to a physician in Trivandrum, in Delhi, or in San Diego, or in New York. Simple as that. Based on what your need is. And based on what your need is, we can connect you. It doesn't matter where you are. Sorry. So we can connect you wherever you want to be. So that gives us tremendous capability.
So American Mission Hospital is going to have
Yeah,
this sort of...
yeah. Not the new hospital is going to be built on that model,
Okay.
where we will have the capability to connect a patient in Bahrain to facilities anywhere in the world.
So anywhere in the world, as in you have partners?
Yes,
outside-
we will
so
have
you-
partners both in the US and India and Europe, where we can access, specialty consults, so on and so forth. So that way, a patient doesn't have to travel. He doesn't have to figure out how to find the best doctor. We could find out. Say, for example, you're a cardiac patient or you are a patient with a specific illness. You don't have to Google, because Google will give you 101 things that you can't quite figure out. We can figure that out for you. And based on your insurance, your ability to pay, we can actually tie you up with the best provider of care anywhere in the world, including providing the care locally here in Bahrain. If you're a Bahraini or if you've got insurance, an insurance provider will pay for that. So it is that kind of capability we are building. Okay, so the model of healthcare for the future is going to be very, very different from this traditional model of what you're experiencing here. But in order for us to do that, we need to have the infrastructure and the capabilities to do that. So when we are building this new hospital, we are building it with all of that technology put in. And already we are sourcing technology, this technology both from the US and from other sources to actually build our infrastructure up. So it is not just building an infrastructure of building a nice building with granite or marble or glass, but having the capability to deliver that kind of healthcare. Now, the third element to all of this is, now you think, my gosh, this is highly sophisticated. But the third element to it is actually going to make healthcare cheaper. See, now, there is no point in having very sophisticated healthcare. If you don't have money, you can't access care. That's the current model of healthcare. If you either can't pay or if you don't have an insurance card, you can't access care. Simple as that. The poor people die because of lack of accessibility. Here, at AMH, we are a not-for-profit hospital. So profit, there are no shareholders, there are no stakeholders. We don't have to provide shares for anyone. All we need to do is provide a service for the people at a cost that keeps us operationally solvent. That's what AMH has done for 120 years. As long as we are operationally solvent in the way we provide care through the charges which are easily affordable for most people, from the poorest to the richest, then that is healthcare that is delivered at point of need at point of care for the right patient at the right time. So that is very different rather than having the current models of healthcare. If you have insurance, you can go. If you don't have insurance, you can't go. So this is what we're doing. So this is I've just given you a small snapshot of our vision of what we are developing.
Right. And how many years does it take to develop this?
This we are planning to bring this new hospital to become operational, hopefully by the third quarter of 2022.
2020.
Yeah, the planning for it has already started. The permissions, it takes a while to get all of the. So all of that is actually started. So by the summer third quarter of 2022, hopefully we will have the hospital.
And where in Ali is it?
This is in Ali, opposite the Ramli Mall.
Okay.
If you know the Ali, there's a big copper pot roundabout.
Yeah.
If you go around, near the driving school. The driving school is on one side, on the opposite side.
Right. So how much are you investing for this?
The total investments will come to about 20 million BD.
20 million BD.
Yeah, 20 million BD for the whole project. Yeah.
Okay, fine. And so how many clinics and hospital? I think you have one hospital, and then how many clinics you have?
We will have two major wings to this hospital, which will have 100 beds. It'll be 100. When I talk about 100 beds, is 100 single rooms for patients. Every room is a single room for a patient. A patient will not share another room. And then we will have a maternal and child health wing for women and children, and then we will have another wing that will be for all of the specialties. So it will be two wings attached together, and it will be a total of 100 beds. We will have the capability to expand more if needed, but right now this project cost has been costed for 100 beds.
Is it bigger than this hospital?
Much bigger.
Much bigger, and also doctors are going to be more doctors. More specialties as well?
There will be more specialties. Yeah.
Okay, fine. So how many number of establishments is it going to make it? Like right now, how many are there? How many AMH?
We have four. We have four currently, and Ali will be our fifth. Yeah. Okay. So when Ali comes up, we will have two hospitals. One hospital in Manama, one hospital in Ali, and 3 ambulatory care facilities.
Okay, fine. So this will focus mainly on Ali and that northern.
Yes, and also the Ali northern area, plus patients that require comfort, sophisticated care can always be transferred there.
Through Al-Bahrain.
Yeah.
Fine. And did you check, are there other hospitals there and other facilities? I mean, you felt that the facility there